Welcome to Advancing Health. Behavioral health resources are in especially short supply in many rural areas of the country. Sutter Health in Northern California is committed to dramatically expanding access to behavioral health services for rural residents, and as we hear in this discussion, its game plan goes beyond just constructing new facilities.
I'm Rebecca Chickey, the Senior Director of Behavioral Health at the American Hospital Association. And it is my honor truly today to have two speakers for this podcast. Dan Peterson, who is the CEO of Behavioral Health Services, as well as the CEO for Sutter Center for Psychiatry at Sutter Health, and his colleague, Dr. Matthew White, who is the chair of the Behavioral Health Service Line at Sutter Health. Welcome to both of you, and thank you for being willing to share your time and expertise on how Sutter is expanding access to behavioral health in rural communities. Before I launch my first question to you, though, I just want to set the stage for the listeners who may not know the severity of accessing services in rural communities. 65% of rural counties do not have a psychiatrist, and 70% of rural counties have no child and adolescent psychiatrist. And for nearly 2 decades now, suicide rates have been consistently higher in rural America compared to urban America. So just to level set how important it is that Sutter is doing this work, as we start, could you give the listeners a sense of what is Sutter Health? What's its clinical footprint? And Dan, I'll pitch it to you, and then Dr. White, please weigh in.
Yeah, so Sutter Health is a large integrated healthcare system. We're really geographically focused in Northern California, but we cover the breadth of services across our footprint of Northern California. We have 23 hospitals, we have 57,000 employees, 6,000 physicians, clinicians in our medical groups, almost 6,000. And so we're really quite a large health system. But we are also quite geographically diverse, right? We have hospitals and clinics everywhere from downtown San Francisco, right in the middle of the city, all the way up to Crescent City, a small town up on the Oregon border, 8 hours north. We have a number of rural hospitals, critical access hospitals, and rural health clinics that we're very proud to support.
And for the listeners who may not be healthcare experts per se, can you describe a little bit of your critical access hospital?
Yeah, thank you. A critical access hospital is just a designation for a hospital that is essentially a sole provider in a community. You have to meet certain geographic distance requirements from other hospitals, and really, by definition, be in a rural area. I was actually the CEO at Sutter Lakeside Hospital in rural Lake County several years ago, about 8 or 9 years ago, serving in a community, living in a town of Lakeport with just a couple thousand people there. And it's really meaningful care provided in those communities because you really are the provider that those residents have to depend on. Many of them simply cannot travel, either can't afford to travel, don't have the means to travel, or logistically, because of the needs of their care, cannot travel long distances in order to reach another provider. So the communities really depend on these providers in the rural communities to do, not just to be there, but to do a great job for them.
Well, and I can tell there's a piece of your heart that is clearly committed to rural communities. Sutter has recently made investments to expand behavioral health services in 2 rural areas in California. Can you tell me about that? Let the listeners know what you're doing and why.
Yeah, I'll start with some of our capital investments, and then maybe Matt can talk about some of the programs. We have recently announced we're building more infrastructure in these rural communities. That's an important piece of what we have to do. So we are going to be building some additional office buildings, about 18,000 square feet of additional office buildings for primary care and urgent care up in Crescent City on the Oregon border. We're also really excited to announce something called an empath unit, which is a crisis care unit for individuals in a behavioral health crisis, immediately adjacent to our emergency department there in Crescent City. It'll be a 3,000 square foot facility, really designated for behavioral health crises. We're also building an additional medical office building in Lake County at our Lakeside Hospital, another 7,000 square feet or so, about a $5.5 million investment in that community. And this coming summer, we'll be opening another rural health clinic in Los Banos, actually, just outside of Modesto. We have a rural hospital there, and we're excited to open a new rural health clinic there, which does tie into our behavioral health strategy as well, as we're really looking programmatically to embed these services in our primary care offerings in all these communities. And Matt, as a psychiatrist, can probably talk a little bit better about that, the strategy behind that and why that really works well.
Dr. White, you're up.
First, I'll expand on the empath unit a little bit and then talk about some other ways in which Sutter is supporting behavioral health in these rural communities. As Dan articulated, Crescent City is up on the far, far north coast of California. And it's really pretty much an island in a very rural community. So if you're in a behavioral health crisis, you end up in our emergency room there more often than not. So Sutter recently got some state funds to build a specialized kind of crisis care unit, a crisis stabilization unit. But an empath unit is really a particular type of crisis stabilization unit. It's designed differently in a more therapeutic way. It doesn't have the bright lights of an emergency room. It tends to have chairs rather than gurneys. It's really just a much more soothing environment, and it's shown to have significant reduction in hospitalization rates and reduced lengths of stay. So we're really fortunate to be able to leverage a state grant opportunity to kind of provide a place where folks in crisis in that area can go to get more therapeutic relief than the current state.
So it sounds much more patient-centered for someone who is in a psychiatric crisis compared to an emergency department, which, as you articulated, can be loud with lots of lights and lots of activity. You really are being able to deliver patient-centered care in a different way. Is there an average length of stay? What is the time period usually?
It's significantly less than 23 hours, so that the average length of stay in an emergency room in these rural communities can be literally days sometimes, because if you need to be in a hospital, there's very few resources around. So people can spend several days sometimes waiting to get a hospital bed and then travel 6 hours to the nearest hospital. Because empath units are more therapeutic, actually folks don't end up getting hospitalized quite as frequently and can get the care they need right then and there instead of going a long distance after a long stay.
If that's not patient-centered care, I don't know what is. I know that Sutter has been the driving force behind some of these initiatives, but have you had engagement or worked with community partners?
Yeah, the empath unit is a perfect example. It actually started a number of years ago where our community benefits liaison had been working with local behavioral health and local tribal entities because it's been a long identified problem. And they actually got some early seed grant funding a number of years ago to sort of plan for something like this empath unit. So when this larger grant opportunity came along last year, which was prioritizing projects that were kind of quote shovel ready to go, because of the existing kind of groundwork that Sutter had done working already with the local communities and hoping and planning for one of these empath units. It was a project in a grant application that really rose right to the top and got funded because of, again, some of that community work that had already been happening.
Dan, anything you'd like to add about the community partnerships?
One of the things that I have loved about working in rural communities is you have an opportunity to truly rally everyone in the community around something, right? Because there just aren't that many people to rally. And so it is logistically possible to bring together all the stakeholders, to bring together multiple interested parties, multiple interested organizations, and get them all physically at the same table and co-develop some of these ideas. It's an ideal scenario in many ways. I think sometimes we think of the rural communities as having challenges and difficulties because that's true. But on the other hand, there are some of these advantages where you truly can bring the whole community together and come up with a dream and a vision as a community in a way that is far more difficult in a metropolitan area.
Oh, I so concur. I grew up in rural Alabama in a community of about 30 homes. So everyone knew everybody. The local police officer, of the tiny little town 7 miles away used to come mow my mother's grass. I mean, her primary care physician was right down the street. And so the support system and the ability to identify needs and then come together and collaborate to meet those needs, it's truly unique in rural communities. Beyond the empath unit, can you share how Sutter is working to expand access to care in rural areas in California?
There's a couple ways, actually a number of ways. As Dan mentioned earlier, finding a psychiatrist or even a therapist is so challenging in those environments. So one of the initiatives Sutter has been leveraging virtual opportunities in telepsychiatry, and one such way is through embedding primary care into behavioral health using a nationally recognized model called collaborative care. And so we've been able to stand up collaborative care using a virtual provider. So this is where a primary care physician can get support and access to a therapist for the patient and psychiatric support for help medication management through Concert Health, our virtual partner. Additionally, in Los Banos, which Dan mentioned earlier, Sutter has recently hired some nurse practitioners to serve patients in their rural health clinic.
One of the reasons that this model is so successful, we've in Sutter Health, we've embraced this collaborative care model, is because it really allows our clinicians to work at the top of their license, and it allows us to maximize our clinician workforce. Right? There are only so many psychiatrists out there, and there are only so many psychiatric nurse practitioners and advanced practice clinicians. Like, clinical workforce, especially in rural areas, is difficult to come by. Recruitment is difficult. There are many rural communities that you just can't find a dedicated psychiatrist to come move to that rural community. But by embracing other care models that sort of allow these clinicians to come in and consult on the care of the patient and allow the primary care doc to continue to be the prescribing clinician, but with the support of a psychiatrist, those models really lend themselves towards virtual support, which is very helpful in the rural communities. And second of all, it helps you sort of maximize the impact of the workforce that you do have available. And so then, we look at places like Los Banos, where we haven't been able to bring in a psychiatrist for that model, but we have had success in recruiting a psychiatric nurse practitioner, or some of the other areas where we're able to find some therapists and they just need some support, or we have a strong core of primary care docs, but they just need some support from a psychiatrist. Embracing different types of models like that really just helps logistically embrace the challenge of recruitment in those areas.
So it sounds like from this approach, you are meeting the patients where they are. You're better supporting the staff, the clinicians that you do recruit, practicing at the top of their license. I've seen some studies in integration that show that integrated care or collaborative care not only improves patient satisfaction, but workforce satisfaction. It can reduce stigma, which can be great in rural communities. It has just an abundance of positive outcomes. So thank you for taking it there. Dan, Matthew, thank you so much for being here with us today and for sharing your experiences and your innovative ideas on how you're improving access to behavioral health services in rural communities. And before I go, I'd like to remind everyone that November 20th is National Rural Health Day. Be sure to check out the links in the show notes below for a wide variety of resources that'll allow you to participate in this important awareness day.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.